Doctor, you said that the patient suffered from a fractured clavicle? That is correct. Actually, to be more accurate, the subclavicle. And what is that area called? It is the subclavicular area. And that is where? That is beneath the clavicle or collarbone. Doctor, the clavicular is the clavicle, is that right? Yes, this was beneath the ribs, however. So it was not subcutaneous. No, it was not, which would be beneath the skin. Doctor, was there a involution? No, there was no involution, which is a failure of the uterus to reduce to normal size after childbirth. But there was suppuration, doctor? Yes, there was suppuration, that is, the presence of pus formation. Doctor, let me ask you about the supernatant nature of this operation. Very well. I assume you are talking about floating to the surface. Well, I am talking about the supraoccipital region, actually. Well, in this infant, there was situated above the occiput a trauma. And this trauma was what? It was suprapubic, actually. And was there a cystotomy performed? Yes, there was. It was an incision, that is, above the symphysis pubis, there was a surgical opening. Doctor, that is the suprarenal that you mentioned in your hospital record? Well, that would be pertaining to the kidney. The adrenal gland is above the kidney. Doctor, what is the symphysis pubis? The symphysis pubis is the fusion of pubic bones on midline anteriorly. And that is a movable joint? Well, it is an immovable joint, actually. It is a synarthrosis. Doctor, you say a synarthrosis? That is correct. And what is syndactylism? Syndactylism is close. It refers to the digit or finger, and it is a fusion of two or more fingers or toes, that is, a webbing. Doctor, let me ask you about the transection in this operation. Yes, it was an incision across the long axis, the long cross-section. That was a cutting, doctor? Yes, a cutting. And it was a cross, you say? Yes. That is why it was a transfusion, which is a pouring. It is an injection of the blood of one person into the blood vessels of another. And was there an excision of the prostate gland through the urethra? Well, I don't have that noted in the hospital record, so I can't comment on it at this time. Doctor, what is the tricuspid? The tricuspid is having three cusps or points. The tricuspid valve is usually referred to in that way. And were there three, you say? It was trifacial, actually, because the triangular space, especially that of the lower part of the urinary bladder, was impinging on the fifth nerve at that area. Doctor, what is the hypochondriac region? The hypochondriac regions are the upper lateral regions beneath the ribs or costal area. And doctor, the epigastric region, that is the region of the pit of the stomach. What about the lumbar region? That is the middle lateral regions. And the umbilical or umbilical region, that is the region of the navel. And the inguinal region, that is the lower lateral region. And hypogastric region, as I asked you before, that is a region below the umbilicus. Doctor, were there clinical divisions of the abdomen? Yes, there are several divisions, such as the upper right quadrant, the upper left quadrant, the lower right quadrant, and the lower left quadrant, finally. Doctor, what are the cervical regions? Let me finish the regions if you wish. Yes, would you do so, please? There are the cervical, the thoracic, the lumbar, and the sacral regions. Doctor, are they, with respect to position and direction? Well, let me first ask you about the afferent. The afferent refers to conducting toward a structure. And the anterior? The anterior, or ventral, is front of the body, not synonymous in the lower limb. And central? Central is toward the center. And distal? Distal is peripheral. It is away from the beginning of a structure, away from the center. Doctor, we mentioned afferent before? Yes, we did. And what is efferent? Efferent is conducting away from a structure. And caudal? Caudal is away from the head, situated below another structure. Caudal generally refers to the tail. And intermediate? Intermediate is between the median and the lateral.